Mark Carter, what is contact tracing?
Well, contact tracing, Barbara, is a decade-old process used by health departments to contain the spread of communicable diseases.
So Governor Beshear in his briefings tells people to wear their masks, social distance, and if a contact tracer calls, answer the call. So let's walk me through that process, if you will. So let's say, God forbid, I've been exposed to someone who tested positive for COVID-19. They put me down as someone that they may have come in contact with. Then what happens?
Well, then once that's handed off to a tracer, right now you would get a call that would originate in your local health department. So if you live in Bowling Green, it would come from the Barren River Health Department.
And would it show up on my caller ID as Barren River District Health Department?
Well, that depends on the local carrier and who you have. I think that, it varies by jurisdiction, frankly, Barbara.
And you see why I'm asking that, because a lot of people, if it's an unknown number, they'll think it's spam. They're not going to answer.
Right. Now, what we are doing is we've established an 800 number, 844-KY-TRACE, that will be going live shortly. And we are working with the carriers to make sure that the maximum extent possible that number shows up on the phone when the health department calls. It'll also be the number that's been out if we have to leave a message for folks to call back. And then through the system, it'll route them back to their local health department.
Okay, so the contact tracer, I answer the call. They're going to ask me what? Who I've been in contact with?
Well, they will alert you to the fact that you've had a potential exposure to COVID. They'll talk to you about the nature of that exposure and the level of risk that you may have. And then based upon that, they'll give you advice on what you should do to protect yourself. If you have low level of exposure, they may just suggest to you that you watch out for the 10 or so symptoms of COVID, monitor your health, and do the other things that you need to do, like social distance and wear your mask. So it may be a fairly, not that intrusive a situation if it's low risk. If it's high risk and your exposure means that you're likely to get the virus, then you're going to be asked to quarantine for a certain number of days, and that's changing. The CDC just issued new guidance, and I believe it's 10 days now instead of 14. But at any rate, you'll be asked to quarantine for a period of time, and then the tracer will also ask you about any issues that you might have in quarantine, in having to quarantine. So if you have trouble with transportation, for example, you can't get groceries or your prescriptions, they would help with that. Or if you had childcare needs, those kinds of things. But it will be very much focused on explaining the nature of the virus to you, what you need to do to protect yourself. No one will ask for any financial information or social security numbers, anything like that. And that's the nature of the call.
And all of this remains anonymous. The privacy is respected. Yes.
It does. The privacy of the individuals are respected, and it's a secure platform. As I said, the departments of health have been doing this for years, so they know how to protect someone's privacy and their private information. Just about anything they deal with typically is a sensitive matter personally.
Mark Carter, thank you so much. You're watching Coffee Near Me. We've been talking with the man who has been charged as executive advisor for the state's effort of contact tracing in the COVID-19 pandemic. You can keep that conversation going. Who would you like to sit down and have a cup of coffee and a conversation with? I'm going to do a cheers to you. Good luck with your effort, and thank you for what you're doing, Mark. Appreciate it.
Thank you, Barbara.
Thank you.